guys, Amanda Peichel, owner of AZ Living Team, brokered by my home group. Here with you today at Arizona Infusion Center, located off of 79th Avenue between Bell Road and Union Hills. Let's meet Tony. Thanks for joining us today, Tony.
Thank you. Thank you for coming.
Yeah, my pleasure. We're really excited to learn more about you and your business.
Yeah.
You mind sharing with us a little bit about yourself?
Yeah, my name is Anthony. You can call me Tony Owero. We've been here since 2001.
Okay.
We were intending to open in 2020, but COVID happened.
Yes.
So then we said, regardless of COVID, we are going to open because a lot of people need the services we offer here.
Yeah. So tell us a little bit about AZ Infusion Center. What makes you guys different?
So AZ Infusion Center is a place where we treat depression, PTSD, OCD, all those mood disorders that are resistant to drugs.
Okay.
If you've been on medication, anything for depression for more than 3 months, and you feel like it's not working for you, there is hope, because ketamine is an anesthetic drug, and it works for those conditions. Actually, in one infusion, you feel relief. With pills and all that, you might be taking them for months without even feeling any relief.
And you can feel it after one infusion.
One infusion makes a big difference in a lot of people.
And how long does that last? Like, how often are people needing to come in for that?
There's a protocol that is used for the ketamine infusion anywhere in the country. So you need an initial of 6 infusions to begin with. Okay. Those 6 infusions, the reason why they are done that and they are done so close together, you have to do all 6 within 2 weeks.
Okay.
So that helps the longevity of the ketamine.
I see.
You might just do the one and then it lasts just 1 week, you're feeling so good. Then the following week you're like, yeah. But if you do the 6, there's a chance you'll be able to hold yourself up for at least a month. The more you do a month booster, then the longer it keeps extending itself. So some people come here after every month, some people come here every 2 months, some people, I never see them, some people is every 6 months.
That's awesome. So much better than taking a pill. Don't forget.
Yep.
You know, it's just done.
Yeah.
So what inspired you to create Arizona Infusion Center? What's behind that?
My background, I'm a nurse anesthesiologist or nurse anesthetist.
Okay.
That's my background. I have worked in ICU. So I've been in healthcare for a long time, almost close to 20 years. And I've seen people who've been real depressed. No hope, they don't know where to turn. So the last 10 years, I've worked as in the ORs and all that. I've worked with ketamine. I didn't know it used to treat these conditions. But then like 4 or 5 years back, I started hearing, hey, ketamine treats depression, it treats anxiety issues, it treats OCD, it treats PTSD. And I started looking at it. So in 2018, I contacted a guy who used to have a clinic down in New Mexico. And he has started this institute to teach people about ketamine and providers like me how to give it and how to, start a business like this.
Wow.
So I took that course, and that was downhill from there.
It was downhill from there.
Yep. So I decided, we'll open this place up, and then I found a partner. He's a doctor, MD. He's a pain specialist, and he have the same passion as I do, and he wants to see people feel better.
That's
so
awesome.
I told him, hey, can we get together in this? And so we opened this place up.
Yeah, I imagine there would be a real need for it, especially post-COVID, right?
Yes.
A lot of people being in isolation, I'm sure that didn't help with...
It did not help.
Anyone who has any type of mood disorder,
Yeah, the only thing ketamine we don't treat for is like schizophrenia.
Okay.
Because already, they are out of, you don't want to exacerbate that.
Right.
But all the other mood disorders, ketamine can do. It also treats pain, especially neuropathic pain caused by things like fibromyalgia. It's really good for that. I've seen real good results.
That's amazing.
People treating that. Some other pains like people who have amputations, they have what's called phantom limb pain.
Right.
It's real good for that. It also treats other chronic pains like CRPS, which is chronic regional pain syndrome.
Okay.
It's also very good for that. Those infusions for pain are much longer than the mood disorder ones, and the dosages are a little higher.
Yeah.
Then so.
Well, it's amazing that one drug can solve so many problems. That's
Yes.
really exciting. I imagine you have a lot of customers who are very happy, but do you have an experience that just stands out in your mind? A memorable one?
I have a lot.
That's good. That's not a bad thing. To have so many.
I have a bunch actually.
Yeah.
I've had soldiers who've had trauma.
Yeah.
The one that stands out mostly for me is this guy who was in the Panama War.
Okay.
He's been having nightmares. Those are years ago.
Yeah. Yeah. Long time.
Long time. He's been having trouble with PTSD.
Yeah.
And his wife found out like we are doing ketamine, and he brought him here. Since then, all he comes for is a booster once in a while, and he's good.
Yeah.
He sleeps better. He deals with situations much easier.
Yeah.
He's coping.
That's amazing.
Let's put it that way.
Yeah.
Life
so
has
before there was
changed.
no relief. For
There was no
him.
relief.
He's
Whatever
been
he
dealing
did.
with this PTSD for years, and then
Exactly.
he can manage a lot better.
He can manage way much better.
I love it.
Yeah.
So tell me a little bit about what made you decide to come here. Like what inspired Arrowhead area?
I used to live here in this area, and I really loved it. Just down the street from here, actually, was my neighborhood for 5 years. So after a while, we built another house up in Peoria, not far away.
Yeah.
So this area, I'm used to it. I know how it is. I'm familiar with it.
Yeah.
I know it's a good area.
Yes.
It's a good area with the schools and all that. My kids used to go to school here. So I was like, hey, I'm looking around where I live. So Peoria here, around here, and I found this place. And then I was like, yeah, that's perfect position, location for me.
Yeah.
Because I also don't have to drive very far coming here.
Yes.
So
it's very convenient. You're very
Yes.
close to the 101 right here, so easily accessible. What's the
Exactly.
best way for anyone who's interested to get in touch or schedule? What's the best way for them to?
The best
do
way
that?
is to call us. Our
Okay.
phone number here is 602-325-2020. Or you can contact us on our Facebook page at AZ Infusion. That's Facebook. Also, we are right there. The other thing, just walk on over here. We will take care of you. We will, tell you. We will tell us what you want, and we'll book you for an appointment.
Okay.
And right now we are giving free consults actually.
Oh wow!
So that's a plus. If you're out there, you want to be evaluated, we won't charge you a penny. Come, we'll talk to you, and you tell us what's going on. We'll see if ketamine is a good fit for you, and you go from there.
That's great. All right, so really no risk. Might as well come in and see what you guys are all about, and whether or not it's a good fit for their
And if you have more questions about ketamine, I know there's a lot of information out there on the internet about ketamine. We will go through it. We will tell you what the side effects are, what if there's any. We will tell you what to expect and all that. But people are fearful of ketamine sometimes. They don't know what it is, and that's the biggest challenge we have.
I see.
It's the teaching. People don't know it's out there. People don't know there's hope on this drug. The FDA approved some ketamine. It's a nasal spray.
Okay.
It's called Spravato, but it's one part ketamine. So they kind of took one part of the ketamine out so that it's approved by the FDA.
I see.
It works, but not as well, because first of all, you're spraying it in your nose. So how much absorbs and how much
versus
doesn't.
an IV.
The IV is 100% bioavailability, versus nasal spray can be anywhere from 10 to 50% bioavailability. So the results are not as awesome as the IV ketamine.
And I imagine would take a lot longer to build up in the system versus an IV.
Yeah, it's there for if you don't have another choice, at least you have something. Yeah. So, but here we just do the IV
Yeah.
one.
So education obviously is key in most things, right? And so it sounds like you spend a lot of time with your patients, educating them and explaining the use, and so that they know more about ketamine. Because obviously the World Wide Web,
Yeah.
there's everything on there, and it doesn't always apply.
Yeah, exactly. So what we do is on our Facebook page, you can go in there. There's a lot of resources there, especially our website. Our website is www.infusioncenteraZ.com.
Okay.
There's a lot of resources on our website. Go in there, take your time, because we just want to come evaluate, see if the ketamine is a good fit for you. At least learn something about it.
Yeah. And it's a beautiful website. I checked it out. It is really beautiful, and it's very user-friendly. Lots of resources I
Thank
saw.
you. Yeah, and with ketamine, people are afraid you might get addicted and all that. But ketamine at the level we give it here and the dosages we give it here at, it is not addictive at all.
Okay.
You should not worry about being addicted. The side effects that you feel are when you're getting the ketamine done, because it's a dissociative anesthetic. That means you might hallucinate.
Okay.
You might feel weird feelings. You might have emotions.
Okay.
You might have thoughts that you've never had for a long time. But that's what we want, because that's when the healing starts.
Right.
So, but it's pretty safe. No long-term side effects at all.
Wonderful.
Yeah.
Awesome.
Yeah.
Well, thanks so much for spending some time with us. It's been great getting to know you and learning more about Arizona Infusion Center.
Awesome.
Is there anything else you'd like to share with the community?
Yeah, sure. Also, we do other services here. We have a pain department. If you have any chronic kind of pain, we have a pain certified MD, board certified, who can do injections and all those good things. We also do other kinds of infusions if you want vitamins or anything like that. Hydration. Summertime is coming. Come and see us here. We will give you some IV hydration. We also do other things like PRP, platelet-rich plasma treatments, which is very good for you because it just doesn't mask your condition. It kind of heals it.
Yeah.
So it's pretty good. And so those are some of the other services we offer. But our focus right now is ketamine, because we want as many people as possible to live a normal life and to enjoy life. And that's what brings me here every day, because I can see the results. The results are awesome. It makes me cry sometimes when
That's awesome.
when people
Yes.
come back and tell me, you know what, my life has changed.
I imagine it would be, yes, especially if someone's suffering from living a fulfilling life, and you're able to help them get past that and
Yeah.
return a little bit back to normal.
It is. Yeah.
Very rewarding.
And right now, I know a lot of people think ketamine is just an out-of-pocket expense. We are working with some insurance companies. So come on over if you have insurance. We can check on that. If you are eligible with insurance, well and good. If not, we can work with you still, and at an affordable price.
Wonderful.